There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Good Day Dakota continues on KX News.
It's 5:20. Welcome back. As our bordering states like South Dakota and Minnesota are slowing the rate of coronavirus testing due to a lack of tests, KX News checked in with the North Dakota Division of Disease Control to find out if we too will hit that point. According to Director Kirby Kruger, as of Wednesday, we had about 16 to 800 tests available, and the number of tests the state is running has picked up daily. Kruger says at this point it's impossible to predict how many more supplies the state public health lab will be able to bring in because the supply chain has been unreliable. Most of the test supplies come from the International Reagent Resource, which operates under the national CDC. And then Kruger says there are some private suppliers. He says the state is not at the point where we need to start limiting tests yet, and private suppliers are beginning to make tests. But right now he has no idea when that will happen.
We are going to plan for that, and if we need to roll back, we hope we don't have to, but if we need to roll back, I think we need to be prepared to do that. You know, when we place orders, what we've been getting is either the order is downsized or we're told that it's on back order and we don't know when it's going to come, and so it's been a challenge.
It's up to healthcare providers now to decide whether someone needs to be tested or not. Kruger says certain demographics aren't necessarily tested before others, but you do have to have symptoms. He tells us, as far as he knows, only the state public health lab is conducting tests at this point. With kids out of school and many parents working from home due to the potential spread of COVID-19, stress and anxiety may be affecting many people. Erin Tuner, a mental health therapist in Minot, says parents may unknowingly project their own worries onto their children. She recommends parents process their own anxiety and fears so they can better help their children process theirs. Plus, Tuner has some other tips parents can use while at home during this time.
Asking open-ended questions to kiddos, understanding what is age appropriate for them, ensuring that they're maintaining a routine and a structure. Right now, I think kids are probably still unsure about what's going on. It feels like spring break, but also they know that there is more to it. We also don't know how long this is going to last.
Tuner also says at-home exercise is a great way to reduce stress for the whole family. And a lot of people are turning to comfort food and eating more because, well, we're spending more time at home as a way to curb the spread. That takes us to our question of the day, which you can find on Facebook at KX News and KX News Minot. Have you been less strict with your diet since the coronavirus outbreak began? Looks like 37% of you out there are saying yes, and 63% of you are staying vigilant. Well, each day we learn more about COVID-19, including what medications to take if you have symptoms of the virus. After the health minister of France warned people not to take ibuprofen if they had symptoms of coronavirus, people began to worry. The World Health Organization released a statement saying the opposite. We spoke to a doctor from UND Center for Family Medicine who says it's too soon to prove exactly what's the best to take for coronavirus symptoms.
It's a very fluid situation and things are constantly changing as they're discovering new things about the virus. So what I've been telling my patients is that it's better safe than sorry. Don't use it for now, and there's other alternatives to ibuprofen that you can use.
Dr. Salim says that alternative is Tylenol. And, well, you know, there's no alternative to some nice fresh air. Amber, please tell us, it's the second day of spring. Do we have any of that in the forecast?
Well, we do. I would say so. It's going to be a little cool and crisp for today, but we'll certainly warm in the forecast as well. Back to more spring-like temperatures.